The government is racing against time to tame a new trend of COVID-19 infections through the various border points. In just 24 hours, 14 drivers arrived at the Namanga border crossing from Tanzania. All of them tested positive of COVID-19. 9 of the drivers are Kenyans, while 5 are from Tanzania.
Of course, it's a concern when you see a large number being reported from a border county like Kajiado. The 9 cases from Kajiado are all Kenyan truck drivers who are returning from Tanzania and tested at the Namanga border point. These 9 cases were positive among the other drivers that were tested.
The government has now shifted focus to the border regions to ensure all drivers and any other person entering the country from the East African community is free of the virus. On Sunday, the Minister of Health announced new measures to curb the spread of COVID-19 through truck drivers. All drivers were required to undergo mandatory tests before they start their journeys and go through spot checks along the transport corridors.
If you are traveling from Uganda with your truck, upon arrival at the border, you are supposed also to present a certificate from the country that you started your journey. As long as that certificate is within 14 days, it will be taken as valid. However, we shall still take another sample for verification, because a COVID negative certificate, on the other hand, apparently does not confirm that you could be COVID negative forever. You could have picked up this infection along the way.
However, there are growing concerns that the government could be considering closing Kenyan borders altogether to avoid more infection.
Every possibility is on the table and up for discussion, and when the time comes and it is felt it is necessary, that measure will be taken.
All measures are on the table to be able to address our border with Tanzania. And I think that is why we have gone even a step ahead to be able to test the Tanzanian drivers from the Tanzanian side of the border in Namanga and keep them there as they await their results.
It is now day 1 of the 3rd month since the virus landed in Kenya, and already 700 cases have been recorded, with the number increasing by 20 and 30 people daily. In the last 24 hours, after testing 841 people, 28 people tested positive. Meanwhile, 12 more patients have recovered fully, raising the total number of recoveries to 251. One person, however, died today in Nairobi, bringing the death toll to 33. Mombasa County still leads in the number of new infections with 10 cases, followed by Kajiado with 9, all of them truck drivers who had traveled from Tanzania. Nairobi recorded 7 new cases, while Wajir County had 2. In Nairobi, 3 of the cases came from the Kenyatta National Hospital. 2 are from Embakasi, with Kibra and Pumwani reporting 1 case each. In Mombasa, Mvita area still leads after reporting 3 new cases. Changamwe, Nyali and Kisauni each had 2 cases, while Likoni had 1 case. In Wajir, the cases reported came from Eldas and Tarbaj villages. All the cases have been linked to runaways who escaped the lockdown in Eastleigh, Nairobi. Dennis Matara, K24, Evening Edition.